Hi, this is Dr. Donald Pelto. I want to talk a little bit about something called plantar fibroma. A plantar fibroma is a growth that happens on the bottom of the plantar fascia, and it usually shows up as little bumps on the bottom of the foot. And they may be painful, they may not be painful, they may get bigger, they may stay the same size, sometimes they can go away on their own. So first of all, what causes them? Really, we're unsure. Sometimes people may think it's trauma, some type of an injury to the area. By injuring it may cause some excess scar tissue. There could be some genetic reasons to it, but regardless, they tend to be quite painful for people if they get too big. And how we can diagnose it, many times with an exam, if you feel it, you can feel there's a thickening in there. You really have to verify that it's not a ganglion cyst or some other type of a soft tissue mass. An x-ray really isn't going to help you that much because it tends to be soft tissue and not bone. X-ray shows more bone, so an MRI is helpful. Here you can see some thickening of the plantar fascia right here, a little bulbous type of thickening in the plantar fascia, and also some thickening right here. So an MRI is usually the best way, but the only reason to do an MRI is if you're really trying to make the diagnosis or if you're considering removing it. The different types of treatment options, you could try a cortisone injection. That would be done to help kind of shrink down the size. That works sometimes. Orthotics can take some of the pressure off the area. Okay. So they'd have little cutouts where those plantar fibromas are. Physical therapy is going to be used to stretch it, or something called verapamil therapy. This is verapamil. It actually works in the plantar fibromatosis area. Everything's disorganized, and it helps to reorganize things, allowing it to be reduced. Once again, this usually isn't covered by insurance. Sometimes these compounded pharmaceuticals are, but you could try this as well as another non-surgical approach. We try to avoid surgery at all means for plantar fibromas, but if you eventually do have to do surgery, it's a big surgery. You have to open up the whole plantar fascia, take out a big portion of it, and then close it up. And there's a high rate of recurrence, somewhere up to 80%. So you'd only do it if it really, really hurts. And there's a high chance that it would come back anyway. So if you want to learn more, I'm going to put a link here for one of my patient handouts, a patient website on plantar fibromas for you to learn more. And there's also information about that verapamil therapy.